Hi, I'm Garrett. This is the blood transfusion pass-off. I'd first check the order. See, yeah, we have a blood transfusion for Darius' son. I'd make sure his blood's been cross-typed and matched. I would verify that he's had a written consent form. It looks like he has. And alright, everything looks good. So I would perform hand hygiene. And I would actually do it if I was in real. I don't want to spend half a minute trying to scrub my hands dry so I can get gloves on. Knock, knock. Hello, Mr. Hassan. My name is Garrett. I'm going to be your nurse today. And we're just going to do a blood transfusion. I know your doctor's gone over it a little bit with you. I'm just going to kind of reiterate some of the things that he said. If you have any adverse reactions such as fever or itching, you got hives or a rash, you got to let me know right away. We want to get that blood transfusion stopped. I would assess the patient's vitals first. And after I do that, make sure they all look good just so I can get a baseline. I would assess them for fluid overload. I check their arms for edema. And take this off so I can see your legs real quick. Everything looks good. I feel pulses. Perfect. Everything looks good. I would look for JVD. I don't see any signs of it. I would then assess their lung. I would auscultate their lungs, just listening for crackles or any abnormalities in them. I feel 6 points. Take a deep breath in. Back. Perfect. There's no crackles. Everything sounds to be good. Any medications I need to administer, I'll administer now. You have at least 30 minutes before the transfusion, just so there's no complications with that. I'd verify the consent form with them again, just make sure they understand what's going on. I would then be okay. We're good for the blood bank. Oh, I would do his IVs first. I'd go ahead and flush both of them. They're both going to be. There's going to be 2 large bore IVs. They're both going to be 16 gauge. Just make sure these IVs are patent before we start anything. Scrub the hub for at least 15 seconds. Close enough. I would not throw trash in a real patient's room. This is a real patient. Like that. It flushes beautifully. There's no signs of infiltration or nothing of the sort. I flush that line too. And then I'd say, okay, I'm gonna go get your blood real quick. Give me 1 second. I will then go to blood bank. Bring this. Hello, blood bank.
Hello.
I need blood for my patient Darius' son.
Darius' son, you got it.
Date of birth, it's 08
08
10
10
XXX.
XXX.
The MRN is 982
982
451
451
367.
367.
And then his blood type is, or we'd have a cross match, I would say. It was what, A positive. And then I need O negative.
Yeah, we've got O negative here for you.
Perfect. And then after everything checks out, I will take the blood. I walk back in the patient's room, At this point, we need to get this blood at least going into the patient within 30 minutes. And start transfusion as soon as possible. I would then call a nurse in. Hello, I have blood. I need you to verify with me.
You bet.
Okay, I have Darius Hassan,
Darius Hassan,
08
08
10
10
XXX,
XXX,
and then I have 982
982
541
541
367.
367.
Perfect.
Perfect.
And then have you verify the tag with me.
Mm-hmm.
007
007
0134.
0134.
It's O negative. We can see that right there, right
O
there.
negative. Yep.
Perfect.
Looks good to me. Look
Looks
good,
good.
to you?
No cloudiness, no bubbles, no foul odors. I think we're good.
Perfect. I think you're good too.
Okay. Now we have our blood. We're gonna, and that's all checks out. We get all of our stuff. Go, we're gonna primary line. Sorry, filling up. Oh, that's good. Okay. Well, we fill this up to the filter. Perfect. Okay, that's all primed. Clamp. Clamp. That's clamp too. And go ahead and scrub this cap one more time. Just be as safe as possible. Okay, that's all hooked up. Now we're ready for our blood. Let's get this clamped. We do our best to not get blood everywhere. That tongue. Okay, that's all filled. Looks like we're ready to go. I'm gonna run the patient one more time, just about adverse reactions. We'll go ahead and open this up. Get that going. Like this. Like that. And ideally, this will start flowing. Oh, there it goes. And then once it gets to our patient, we go ahead and slow it down. Well, we're going to go 2 milliliters per minute. the first 15 minutes, then we slow it down to the whatever the provider ordered it to be. And then, so it's flowing at 2 liters a minute. We'd have a pump, maybe. I don't know. I'd assess the vitals again after 15 minutes. Make sure there's no. Make sure the vitals are clear. Then assess again for adverse reactions. And there's none, so everything looks good. After we administer it in under 4 hours. After those 4 hours passed and this is all gone, we'll say it's all gone. Go ahead and clamp. And then we start running this wide open until this is cleared. And we'll just pretend it's cleared. We can pretend. This is cleared. If there were adverse reactions, I guess probably wait for this to clear up a little bit more. If there were adverse reactions, we'd stop the transfusion immediately. We would disconnect this, make sure there's no more blood getting to the patient. We'd start saline on the other side using that IV, have it running wide open. We would notify the provider. We would take everything that has blood in it. We'd put it in our little biohazard bag and we send it to the lab to get tested because there's something wrong with the blood. But since there's none, we're okay. So let's clear up a little bit more. We'll say it's completely clear now. It needs to be completely clear. Go ahead and clamp everything. Everything looks clamped. I'll grab my biohazard bag. I'm gonna go ahead and put this right here so I don't make a mess. Make a mess with this either. Maybe we wanna. Oh, you're stopping me. We'll throw this all in here. We'll send it into the biohazard waste per whatever the facility policy is. We'll say this shit right here. And then I would remind the patient about adverse effects can happen hours after the transfusion. I'd remind her just you need to call us if there's any if you feel anything. Then come in. We'll get you reassessed and reevaluated. I'm gonna flush the remaining part of this. Well, I shouldn't practice that. Did I break my flesh? No, I don't think I did. I would then flush this, make sure there's nothing left in there. And I would reassess one more time. I would get vitals again after the transfusion is completed. I would document what I did, and then I think we'd be